A warm good evening, everyone. It's a great Sunday today. It's the fourth day of the International E-Conclave. Very interesting day because on the last 4 days we have been, since the last 3 days we have been speaking about a lot of things about pharmacotherapy related to tobacco cessation. So because now we are moving towards the panel discussion.
And let's have those brief but very critical remarks, gems of wisdom, experience, advice from a panel that I think I'm more than privileged to moderate, because we have an eminent psychiatrist, a gifted professional, and much more. Dr. Pratima Murthy, Director NIMHANS, for your remarks, please.
Thank you very much. It's been an absolute pleasure listening to all the various discussions, the summaries of the previous couple of days, as well as the interesting emerging topic of genetics. And it's nice to see friends who have been on this journey of tobacco cessation for for a couple of decades now. I just have to look at the journey that tobacco cessation has undergone in our country. And it's possibly in the early 2000s that we actually started the first tobacco cessation clinics in centers of psychiatry, in centers of cancer, as well as in some NGOs. And now, so in the last 20 years, I think initially there was a lot of hesitation to use any kind of pharmacotherapy. The government also felt, because of the massive load of tobacco users, that it would be better to start off with initial counseling facilities. And subsequently, NRT has been introduced. It's been a long journey, and as Dr. Swasti mentioned, there has been integration into other programs, particularly the tuberculosis program, as well as the district mental health program and so on. But I think the progress has been rather slow. I remember there was a lot of enthusiasm initially in the early 2000s when patches got introduced as the first tobacco, cessation option. Unfortunately, the cost of the patches deterred a lot of people, and it kind of died down. The interest in actually using pharmacotherapy died down. Subsequently, there has been a gradual increase in the interest of introducing nicotine replacement treatments, as well as bupropion. Varenicline, of course, has, although the evidence is best for varenicline in terms of the cessation quit rates, the cost of varenicline has kind of, undermined its use, particularly in people who cannot afford it. And that's really one of the dilemmas that we encounter, that while people have a huge health cost in terms of the kind of problems that they develop as a consequence of smoking and smokeless tobacco use, when it comes to actual spending, there is a concern about the cost of treatment. And therefore, I think, trying to tell people the benefits of tobacco cessation and therefore the cost benefit of pharmacotherapy remains very important. The second point that I wanted to make is through a case illustration. I had a senior dermatologist who had smoking addiction of several years. I offered him just about everything, the patch, the gums, bupropion, varenicline. He was very hesitant to take it. One day when he went to the United States, his grandchildren put up a notice on the bathroom saying, grandfather, please do not smoke. The moment he came back to India, he said, doctor, give me whatever it is that's going to help me to quit smoking. He took NRT and the smoking treatment, and he quit. So I think this thing about motivating people is very critical, and health situations as context where you can actually bring about this change is very important. So I think as health professionals, we need to seize the opportunity of the health consultation as a thing. I was very struck by the fact that, the speaker, Dr. Raval's discussion on the genetics, because I have a patient just last week who came to me about 2 or 3 years ago. I put her on a course of bupropion. She quit for 3 years. Recently, she kind of contacted me and said, doc, what is the treatment you put me on? Just put me back on it. I want to quit. And she's again quit in the last 2 months. So I think you have experiences of both kinds. The third thing is that you have to retain in therapy. As was mentioned, pharmacotherapy is not a magic bullet. Despite use of pharmacotherapy, the kind of abstinence rates you have are, like for any other NCD, and therefore retention in treatment is also very important, because retention also means that you can use pharmacotherapy effectively. And therefore, in the long run, you can also move people from not being able to use to actually being able to quit tobacco. And that's our experience. You retain people for about 6 to 9 months, and their ability to quit is much more. One of the things I also wanted to mention is that in Bangalore, after 20 years of tobacco work in tobacco cessation, we actually tried to review the facilities that were offering tobacco cessation, and it was extremely disappointing that whether it was solo practitioners, whether it was hospitals, whether it was organized tobacco cessation clinics, there was a lot of reticence among healthcare professionals, whether they were generalists or specialists, to actually, have started tobacco cessation services. So I think it's very, very important to convince ourselves that tobacco cessation is a very important, cost-effective public health intervention that all of us must engage in, and the optimal use of counseling and pharmacotherapy can help people. COVID has brought about a very interesting experience, and I'll talk about the quit line for a moment. In the quit line, as compared to the previous pre-COVID time, we've certainly had near doubling, at least 1.78 times, the number of callers who've actually called with an intent to quit. And that's very encouraging, because I think people understand the complications that COVID can cause, particularly in smokers, and the kind of publicity around it in terms of increased risk and in terms of complications from COVID has also, the awareness has increased. And that's very interesting. We've also had interesting quit rates when people have engaged like this. So I think we need to use the challenge of COVID as an opportunity to help people to quit tobacco. The final thing that I just wanted to mention is the fact that in persons with severe mental illness, the scimitar trial was mentioned earlier. We have also undertaken a trial now of looking at the feasibility of having tobacco cessation interventions which involve counseling as well as pharmacotherapy for people with severe mental illness. Of course, COVID has brought new challenges as far as that is concerned. So we are trying a hybrid kind of intervention, both on site as well as online for these people. Finally, I'll just talk about the few challenges that are there, particularly with NRT. And I think having NRT very easily available has had two challenges. The first is a good thing that people have become more aware. But the second challenge is that people don't use it properly. People don't use it in the appropriate doses, and people don't use it for a long enough period. And therefore, and they also use it in such a way that they swallow the saliva, get a lot of gastritis and side effects, and therefore discontinue it. And then they don't retain in treatment with the counseling. So I think when we talk about planning pharmacotherapy effectively, I think all these things need to be taken into consideration. Finally, I just want to say smokeless tobacco wasn't discussed adequately. In our country, we have a huge burden of smokeless tobacco. So any discussion on tobacco cessation needs to look at both smoking and smokeless. I am just excited that there have been so many people with so much interest in promoting tobacco cessation. And I just hope that this will become a new movement where we will see a lot of successful cessation activities. Thank you very much.
Thank you so much. That and the earlier remarks prompt me to request all the panelists and the two chairpersons to please be with us till the end, because after this panel discussion, I'm going to try, as the conclave chair, share with all of you the consensus statement that we plan to evolve, draft today and the final in next few weeks. Murray, excellent point though. Thank you so much.